Welcome to Risk Adjustment Documentation and Coding for Providers. Today's topic, infectious diseases. Infectious diseases are common conditions in the risk adjustment model, which have specific documentation and coding guidelines. Most infectious diseases applicable to risk adjustment are acute conditions, but there are chronic conditions which are applicable as well. It is important to document and code any chronic infectious disease at least once in a calendar year, even if the condition is stable. However, if an infectious condition has resolved, then the diagnosis should not be included on the claim. Always use the most specific diagnosis if possible, and your documentation must show evidence of MEET, that you've monitored, evaluated, assessed, or treated the condition. To be included in the risk score, the diagnosis must appear on a claim. Today, we will discuss common infectious conditions that are applicable to the CMS HCC risk adjustment model. Let's begin with HIV. There is a very simple coding guideline. You can code only a confirmed case of HIV, and there are two choices. You will use the Z code, Z21, for an asymptomatic HIV infection. However, once the patient has had an HIV-related illness, you will always use the code B20. Regardless of the code, the coefficient is the same. Some other common infectious conditions are primarily acute, such as pneumococcal sepsis or E. coli sepsis. There are other chronic conditions included in the model, such as chronic hepatitis B or chronic hepatitis C. The important point is that once a condition is treated, then you can no longer code the diagnosis. So in the example below, you will see that a chronic hepatitis C that has been treated should no longer be coded with the diagnosis of B18.2. The correct code is history of hepatitis C, Z86.19, which will not impact the risk score. ICD-10 provides for many specific diagnosis codes for pneumonia. However, pneumonia not otherwise specified or a community-acquired pneumonia is not included in the risk adjustment model and does not have an HCC coefficient. The only pneumonias that are applicable to risk adjustment are the specified pneumonias, and some examples are shown below. Again, you can only code for pneumonia while the patient is actively undergoing treatment. It is always best to identify the specific organism if possible, or even the organism class, such as a gram-negative pneumonia. If you do not know the type, then sometimes the mechanism, such as an aspiration or ventilator-associated pneumonia, can be identified and coded. Finally, please be aware of an unspecified diagnosis of lobar pneumonia, which also has an HCC coefficient. This slide illustrates some common acute and chronic infectious conditions that are applicable to the risk adjustment model. Some acute conditions would include Legionnaire's disease or toxic shock syndrome, and some chronic conditions can include arthritis due to Lyme disease or a viral cardiomyopathy. Conditions such as a post-herpetic neuralgia is an RxHCC only. The important point is that you can only code these conditions when there is active treatment or monitoring. Fungal diseases are also included in the risk adjustment model, but these conditions are not common, and they are typically seen in the inpatient setting. The table identifies some of the fungal diseases that are applicable to the risk adjustment model, including coccidiomycosis, histoplasmosis, and blastomycosis. In summary, we reviewed that there are acute and chronic infectious diseases that are relevant to the risk adjustment model. Only code the acute conditions while the patient is actively being treated, and please code the chronic conditions if they are being monitored or treated. It is appropriate to document and code all clinically relevant active and chronic conditions that impact the care of your patient. Your documentation must show evidence of MEET, and do not code conditions that were previously treated and no longer exist. Documentation in the assessment and plan is preferred, and finally, ensure that all relevant diagnoses are documented and put on a claim at least once in a calendar year. Thank you very much for listening.